disruptive to business itself as it had been on the health of the nation, and further storms are coming, so we need to be ready. Throughout the pandemic, the People's Assembly has been campaigning to raise consciousness and expose the failures in the pandemic response. From the beginning of the pandemic, the People's Assembly has argued for proper, effective lockdowns in order to achieve zero COVID. We have given a platform to and amplified the voices of all the various groups of people who've been hit hardest by this pandemic, including key workers and the disabled. We've supported all the supports and struggles of the trade unions as we have moved to the forefront of the struggle to protect the public from the worst impacts of this virus. It has been the trade unions, in fact, that have been the most effective in exposing the government failures and defending the interests of working people and the wider population. Had it not been for the work of the various trade unions, the death toll would have been even higher than the grotesque levels it has already reached. I'm proud that the People's Assembly led the way in launching a zero COVID charter in response to the coronavirus crisis. We are an organisation that has a wealth of campaigning experience, and we've been at the heart of exposing austerity for the last 10 years, and we've mobilised tens of thousands of people, and we've been backed by the trade unions. And the work we do to link up the community and the industrial campaigns will be vitally important in the coming period, as this Tory government will want us to pay for the coronavirus crisis. So the importance of joining a union and the importance of joining social movements like the People's Assembly and the Zero COVID Coalition I cannot emphasize it strongly enough, because the Tory narrative will be, they did their best, and look at how they did so well during the vaccination rollout. So in the coming period, these movements are so vital to be the moral centre of opposition to the Tories and their rotten system, but we must also express an alternative to it. And this means defence of the public sector, an end to cuts and privatisations, an end to unsafe working conditions and the type of working conditions that mentally and physically break people. So as part of this Zero COVID Coalition, we have a website, so we want you to check our website. We've a Zero COVID Coalition Facebook page, so please like our page and follow our updates. We also have a Zero COVID YouTube channel as well, and we're on Twitter, so please retweet us. And in fact, the link for the meeting tonight is hashtag Zero COVID and vaccine. So please use the hashtag and tweet and retweet us. I want to give apologies for Richard Horton tonight, who isn't able to attend the meeting because he's had something come up on the very last minute. So without further ado, it gives me great pleasure to introduce our very first speaker at this event tonight, and his name is Dr. John Puntis, and he's from Keep Our NHS Public, and he's going to be talking about the ins and outs of the vaccine rollout. So over to you, Dr. Puntis. Thank you very much.
Thank you very much, Helen. Thank you for the invitation to speak, and my apologies that I've got to leave for another meeting quite quickly. The government's initial strategy for fighting COVID, and I'm talking about the Westminster government here, was right from the start to look for a magic bullet, to look for a single intervention that would make coronavirus go away and bring us back to normality. And preferably this would be something that was kind of sciencey, high-tech and exciting in the form of an effective new antiviral treatment or a vaccine. In the meantime, other things could be tried to slow the progress of the pandemic, a new contact tracing app, for example, or widespread testing. What was always needed and what's still needed was a joined up raft of public health interventions centered around elimination of COVID by preventing community spread. An effective test and trace was supposed to be operational and world-beating before the end of the first lockdown, but in fact even now does not function effectively. And the crucial element of isolate and support was neglected, such that many people are simply unable to isolate, either from financial reasons or because of housing. It's not just doing more and more tests. That key central principle of identifying those with the virus and separating them from those without was just somehow missed. Now we do have vaccines, and that's wonderful, but it's not the end of the story. We've already seen the appearance of new and more transmissible mutations, driven, of course, by high numbers of cases. And there's no just getting on with it and living with the virus. But on the other hand, we won't simply be able to vaccinate our way out of this pandemic without other measures. We do have evidence that vaccination can stop people becoming ill, but we don't know for certain if it will stop people being able to carry and pass on the virus to others who are not protected. To get herd immunity and bring infection under control, it's going to need about 80% of the population to be vaccinated. And it's clear that that's going to take a long time, despite the good start that's been made. And with vaccine hesitancy and some groups more reluctant than others, it's also likely we'll see infection continuing, for example, in some more deprived cities or parts of cities. So what should the priorities be at this point? Well, firstly, to continue to vaccinate as many as possible and as quickly as possible, now targeting those at highest risk. And the vaccination program is actually a brilliant example of what a public NHS can do at community level if it's left to get on and do it. Strong restrictions must continue, I think, to be in place until new cases are really at a very low level. So don't listen to the COVID recovery group. We still need better workplace safeguards, including higher grade PPE and ventilation. I mean, think of the Driving Vehicle and Licensing Authority Centre in Cardiff with 500 cases recently. Local contact tracing still is neglected and needs to be sorted out through local public health teams so that spread of new cases can be very quickly controlled. And border controls need to be tight, effective with both testing and quarantine of travellers. And then finally, we need to help poorer countries with their response, including access to vaccines, because this is an international problem and it can't be solved simply on a national basis. Does government share this view in terms of priorities? Well, it looks like it's still banking on vaccination as a magic bullet, although it is being a bit more cautious about lifting restrictions. Johnson rejected the call for a public inquiry until the pandemic was over, on the somewhat suspect grounds that it would be diverting energy from the fight against COVID. It should rather be seen as something which would assist in this fight, but it's not going to happen until it can't be politically damaging to the Tories, and that's not going to be for a long time. Meanwhile, we've had the new white paper on so-called integration that's just appeared. This means that the government, while rejecting having an inquiry, is happy to consider a major reorganisation of the NHS in the midst of its worst ever crisis, and without addressing underfunding, understaffing, or the fragmentation and disintegration so much accelerated by Lansley's 2012 Health and Social Care Act. No commitment, for example, to bringing outsourced services back in-house. So far from representing a sea change and a move away from the private sector, as the headline suggested the white paper might be, in reality, its proposals consolidate the role of the market in healthcare, absolutely reflecting the government's approach to contracting out during COVID. Hancock, of course, previously said, "There's no privatization on my watch," just as contracts continue to be handed out at record levels to private companies. And only last week, we saw the covert takeover of GP practices, serving 1/3 Londoners by the US corporate Centene. There's also a £10 billion pound 4-year contract pending with private sector hospitals for taking on NHS work instead of investing in the NHS. So this white paper reforms, they're nothing to do with rolling back the private sector. They're more to do with consolidating it. Just to wind up, Keep Our NHS Public does not believe that even with vaccination, we're near the end of the pandemic as yet. And it considers that very different lessons than those learnt by the government so far need to be learned. To this end, we've set up a People's COVID inquiry chaired by Michael Mansfield and supported by the likes of Richard Horton, Michael Marmot, Independent Sage and others, but also taking testimony from trade unionists, key workers and bereaved families, amongst others. The first session is a week today and details are on our KONP website. Thank you very much.
Thank you so much, John, for that speech that was absolutely packed with points. And thank you for drawing out the points about privatisation as well. Very, very important there. So before I introduce our next speaker, I'd just like to ask viewers to save some dates. So on Saturday, the 6th of March, just ahead of the government's planned reopening of schools and just ahead of International Women's Day, we'll be holding our next Zero COVID meeting, which is going to be titled Don't Ease the Restrictions Until It's Safe. On Tuesday, the 23rd of March, is the 1-year anniversary of the lockdown. So we'll be having another meeting on Zero COVID. We'll be hoping to get some exciting international speakers to address this meeting. So again, save those 2 dates, March the 6th and March the 23rd. And just to remind all of you as well, on Twitter, the hashtag is Zero COVID and Vaccines. So tweet at us and contact us. So now I'd like to introduce our next speaker. Her name is Belle Ribeiro Addy. She's an MP, and Belle is going to speak on the difficulties of distributing vaccines, discrimination, and blaming Black and Asian communities for their own traumas in this crisis. So over to you, Belle. Thank you very much.
Thank you very much, Helen, and thank you very much for the Zero COVID Coalition for inviting me to speak. Now, if there's anything that could be clear from all of this, it's that the government have completely failed the people of this country. An entire year on from the first COVID case, we've got the highest death toll in Europe and probably will end up with the highest death toll in the world. But the pandemic overall has been compounded by neglected public services, a decade of austerity that left all of our public services unable to cope with this issue. The Tories have actually cut back the NHS to the point where we couldn't even cope with the seasonal flu. So coming out of this, we have to remember that if we neglect the public sector and public workers, these are the types of situations we will find ourselves in. Instead, there was a focus on giving gold-plated coronavirus contracts to Tory donors when individuals were left with crumbs, and actually 3 million, the excluded, have been left with nothing. And when the Tories briefed that they were actually going to cut furlough the first time because they said they didn't want workers becoming addicted to state support, that they showed us yet again their true colours, and all their last minute reversals and their U-turns on everything only ends up costing the country more money and ended up costing more jobs. Now, beyond the furlough scheme, we've seen a situation where renters, low-paid workers, and others are completely denied the support that they need. And the UK actually now has the lowest level of sick pay and unemployment benefit of any OECD country. Now, the common thread of all of these is Tory party ideology, just that core decision to look at big businesses rather than the interests of public health. And the Tories throughout all of this have thought that there seems to be some sort of trade-off between public health and the economy, and that's completely wrong, because the most important factor of any economy is people. And they have not put people at the centre of this. And we've seen a disgraceful situation in which, and as we would always expect from a government like this, equalities are always put last. The whole point of having equalities legislation and equalities body is that they are meant to be part and parcel of every single piece of legislation that goes through. And to say that when we get to a crisis, that's the first thing we throw out is absolutely wrong. We've seen it in the case of disabled people, some of those really worrying things they had about social care in the Coronavirus Act, and now issues with people with mental health problems not being put under do not resuscitate orders. These really disgusting kind of eugenics leaning ideals that are being put forward. And then we see a situation where you have Black, Asian, ethnic minority communities disproportionately dying from the virus and being hospitalized with the virus, and all the while the government refuse to acknowledge that institutional racism is part of the problem. In fact, they actively deny that institutional racism is part of the problem, pointing to all of these other factors, and even going as far as to blame communities, as if these particular communities like to live in overcrowded housing, like to be in jobs that are lower paid, and be more likely to be key workers, and find themselves in situations where they are unable or do not have sympathetic employers that will allow them to stay home and isolate. And it's been completely problematic the whole way through, and they continue even to say, even when it comes to prioritization of the vaccine. Now, I'm really worried that with the news of us easing lockdown, we may end up going back to a ridiculous tier system, because they know that things we just can't just end the lockdown such as that. And I think people are really confused, because they're really confused, or they claim to be following the science. Even the smallest kind of town or village, even if they had a low infection rate, they could become a hotspot the next day. People travel. So this idea that we can cut off the country into sections and that will make a difference has not worked before, and it will not work again. We simply cannot hinge everything on the vaccine rollout. I know there's a lot of excitement about the number of vaccines that have got out, and the number of vaccines that have got for the first dose has been good, but unfortunately that never will make up for all of the failures of the past. And quite frankly, to say that people should feel confident in going out of lockdown when people have received their first dose makes no sense. We've been told that you require 2 doses of the vaccine to receive a certain level of immunity, and until everybody in this country has 2 doses of that vaccine, we cannot guarantee that we are safe. And I think instead of trying to put forward some sort of a positive PR image, which they have, and which quite frankly is all designed to distract from their previous failures, we should be questioning the government more on exactly what they're doing with the vaccine rollout, and also looking at what kind of support they're giving to countries in the global south. As it stands, 95% of the vaccines available have already been purchased by rich companies, and this is a real rich countries is a really ridiculous situation again, because as you've heard already, we're seeing a number of different strains, mutations of the virus that are happening, and that will only continue further if we don't have a plan to vaccinate people right across the world. And I know that sounds terribly ambitious, but that literally is what the situation is. We cannot be nationalist about this vaccine and expect to come out of the coronavirus pandemic, because we have to remember that's what it is. It is a pandemic, and we do need to look to the whole world. And in this country, even though things have got so bad, we can still pursue and adopt a zero COVID strategy. So many people have died already, but we can prevent so much more if we just simply look to the science, have proper financial support for people that have to shield. And instead of setting completely arbitrary dates, we need to look at when the cases get to 1 per 100,000, which is what we had done before. We need to increase sick pay so that people can afford to isolate, and we need to fix, test and trace. And if that means completely overhauling it from those awful companies that have like Serco, that have taken all of this money and done absolutely nothing with it, when so many people are destitute because of this pandemic, that is exactly what we have to do. It is a contract after all, and if they have not met their end of the contract, I think it's fair enough to call them out on it. So it's really important that we keep pushing, no matter what has happened, for this zero COVID strategy, so that we can save lives and we can get back to a time of no lockdowns. But if we continue to lock down, end lockdowns too soon, we're only going to end up in a vicious cycle. Thank you.
Thank you so much, Belle. That was absolutely fantastic there. So now we want to show you a 2-minute video from Independent Sage by Professor David King, which makes the case basically for zero COVID. So let's play the video now. Thank you. Oh, the sounds.
The developing countries of the world, and that really is far too long. So we in our own self-interest, because as a new variant appears and perhaps is no longer dealt with the current vaccines available, we all know that it could simply carry on until we get this new family of vaccines produced. I'm going to come back to the point that I always raise. Do we have a coherent strategy in this country to bring this pandemic to an end? Or are we just relying on vaccines in Britain alone to deliver the end point to the pandemic in this country?
Right, I think we have the video stopped. So in that case, we'll carry on with the meeting and I will introduce our next speaker now. His name is Jay Patel. He's from Edinburgh University and he's going to go into a bit more depth on the vaccine rollout and some of the technical issues. So over to you, Jay.
Thank you. Broadly speaking, there are 3 aspects that I want to touch on, and each are sort of from a public health point of view. One of them, and I think this is quite widely accepted now, which is that the biggest threat to the success of the vaccination rollout remains variants. And we're also aware that variants arise, although mutations are random, variants arise in a climate or an environment where those conditions are made easier. And political vacillation is very much at the heart of creating those conditions, or at least ripening those. And the thing with variants is that they pose so many unknowns. We don't know how effective these new sets of vaccines will be to these variants. There is some preliminary data on that, but it is very early and it does show that lower effectiveness is a very realistic possibility. We also don't know how long immunity will last. We don't know whether they will prevent transmission. And so actually to think about vaccines as the silver bullet is quite dangerous because of these unknowns. And also, if effectiveness is rendered much less effective, then we will need to aim for a much higher degree of herd immunity. And especially given the challenges of vaccine hesitancy and uptake, that's really not appealing from the point of view of herd immunity. So clearly we need a more comprehensive strategy that is compatible with any potential variants that may arise. And of course, elimination is clearly the most optimal out of those strategies. So vaccinations on their own are not very helpful, certainly when there are high levels of infection and virus circulating. So to embed them in a strategy that aims towards zero COVID is the best way forward. Now, there has been, especially in this month, a lot of talk about strategy and how perhaps zero COVID is not going to be optimal or feasible, and instead we must learn to live with the virus. But actually this debate is far more polarizing than it needs to be. In fact, the commonalities and the fundamentals are all agreed upon. We know that the best route is to avoid these long lockdowns, which are very blunt and very damaging. We need to have children and young people returning to education. And we also need to avoid the mental health crisis from being exacerbated any further. And actually, if we are to live with the virus, then that's okay, providing infection levels are low, that we have low endemicity. Zero COVID is not about getting to absolute zero, of course, that's been confused quite a lot. Of course, that's more towards eradication, which we realize is not going to be possible. But at least aiming towards eliminating community transmission will have many benefits. And in terms of whether it's feasible to do now, well, there's certainly a case for that. In continental Europe, that's much more tricky to achieve. But Germany have moved towards a no COVID strategy, and the challenges are far more difficult. For instance, Germany have 9 land borders. And one of the advantages of us being an island is that our border control can be much more effectively managed. The other thing to mention is this fixation on the idea of having a silver bullet or a magic bullet. Now, as was mentioned at the start, one of the issues is that vaccines are very impressive as a magic bullet solution. Of course, they are not, but we do know what the silver bullet is. It's just that it's not as metaphorically interesting. It's actually working locally. I mean, that is the route out of this from a public health perspective. Working locally has many benefits across the board. Test, trace, isolate support is one of those systems that would benefit from that enormously. If we look at each step or each component, testing, for instance, towards the beginning of the pandemic, testing was not in a good place. Capacity wasn't quite there. People were driving many miles simply to access a test. But that's no longer the picture, simply because the mass asymptomatic testing has been moved to more community-based forms. Buildings have been repurposed as testing centers. So working locally has managed to make testing much more successful than it set out to be. Tracing, on the other hand, which is currently being coordinated in 2 ways. Either it's one by local health protection teams, and the other method is by the national call center capacity. Now, each week, Test and Trace report their statistics on this program. And since the launch of Test and Trace, contacts that have been managed by the local health protection teams are very successful. About 98% of people are successfully reached. Now that falls to about 65 to 68% when it's coordinated by the the national outsourced call center capacity. And also contact tracing is all about trust. We've learned that, especially from Japan, South Korea, other countries. Japan, for instance, mobilized about 8,000 public health nurses very early on to coordinate the contact tracing. And it was very useful because people could have conversations, they felt as though they trusted these people, and that facilitated honest reporting. So local tracing is certainly the way forward. And then the next thing is the isolation. Isolation is an interesting one because the public compliance to health protective behaviors on the whole has been very high, often above 90%. But full adherence to self-isolation remains very low. Only about 18% are not leaving the home when asked to do so. And yet the intention to stay at home remains high. So clearly one of the reasons for this disparity is support. And there are many other pieces of evidence to suggest that it is the lack of support that is not enabling the high isolation adherence. In New York City, support is provided locally. It's all community-based. People will ask every day what these people require, be it food, delivery, perhaps even a pet needs walking, and they will provide those support services. And as a result, self-reported adherence to isolation in New York City is about 95%, 90 to 95. Based on random checks, contact tracers can identify nearly 87% of people. So that's a clear way that local solutions are needed to drive the successes we want. And the final thing, of course, is this emerging challenge of vaccine hesitancy. And one of the ways to combat that is by providing informational support. The hesitancies arise because of questions that people have that are unanswered. And we need strategies that work with local leaders, faith-based leaders in the hearts of communities that aim to encourage vaccine uptake. So there are some clear synergies to be drawn upon, many untapped opportunities, but we also need to realize that without a strategy, these vaccines really do risk being rendered less effective. Variants are a continual threat, and elimination is clearly the only strategy that would help us move forward with this. So I'll leave it there. Thank you.
Thank you so much, Jay. Really, really good. Yes, so now we're going to move on to our next speaker tonight. And during the pandemic, it's been clear that the students in universities in particular have just been treated extremely badly, but many of them are now getting together and opposing some of the things that are happening. So I'm delighted to introduce our next speaker, who is Larissa Kennedy. She's president of the National Union of Students, and she's going to speak in depth about the situation facing the students and how badly they've been treated. So over to you, Larissa. Welcome to the meeting.
Thank you so much, Helen, and thanks for the invitation to speak this evening. As was just said, my name is Larissa, my pronouns are she, her, and I have the joy and privilege of being president at the National Union of Students. And, you know, when I saw this event title, Vaccines Aren't a Magic Bullet, I really felt that, because throughout this pandemic, the government has been scratching around in search of a magic bullet to dissipate all of the issues that we're facing. They have consistently been looking for piecemeal ways to tinker around the edges of our realities. And of course, we know that this has just been taping over huge systemic cracks with austerity and injustice at their foundations. And you know that there is definitely a trend that's not only happened to students, but to workers, to folks in different communities, you know, with people of colour at increased risk of contracting the virus. We were told to take vitamin D tablets rather than the government dealing with systemic causes of racialised gaps in health and healthcare. You know, when workers demanded PPE and protections from being forced into work during a global health pandemic, you know, they were treated as sacrificial lambs, told that they're heroes and told to wash their hands before being sent back out into the workplace. So I really do see a lot of similarities cutting across the way that profits, that, you know, paving over what's actually happening here has not only happened to students, it's happening to all of us. And just to unpack a little bit of the ways that has impacted the student community, rather than dealing with the problems at the root of the marketized education system and recognizing that this year is merely exposing and exacerbating the financial hardships that students consistently face, this government insists on treating the economic shortfall that we're facing as a short-term issue, meaning that instead of following the sage advice on university closures, instead of listening to the fears of disabled students, Black and brown students, student parents and carers, the list goes on, instead of underwriting fully funding education, the government saw pound signs where they should see people. And so students were lied to about what would be safely possible this year in order to exploit us for fees and rents. And now, months on from that decision, we've ended up in a situation where students are caught in contracts to the tune of £1 billion in rent for housing that is empty, which means that students are essentially bankrolling landlords through this pandemic. It's also resulted in, you know, such an exploitative system that 9% of students have had to access food banks just in order to survive this time, just in order to continuing accessing their education and surviving. And, you know, with all of this piling up, with all of this economic exploitation and injustice that students are facing, we know that in order to achieve zero COVID, we need an education system that centres the health, that centres the safety of not only students, but staff and communities too. And to do that, we need to move towards fully funded education. We need to bolster student renters' rights with the Renters Reform Bill that radically re-envisions tenants' justice. And we need to do all of that knowing that this is about a broader problem. It's not just about paving over what's happening now. It's not just about acting like we can tinker at the edges. It's recognizing that this is rooted in a broader injustice. And, you know, these issues, they weren't just on economic exploitation, and it wasn't just on this issue that they failed us, it was also on academic injustice too, because rather, again, than dealing with the problems at the root of systemic educational injustice, that means that year on year, students from the same areas get the same grades and get into the same universities for the most part, this government has refused to properly invest in the digital infrastructure that makes learning truly accessible. And in fact, our data shows that 13% of students can't even access their learning. And we all know that working class students and Black and brown students, of course, are overrepresented among those who cannot access their education. So all of this is showing us that we need to do something radical. We need to do something transformative to look at our education system, to reorient our understanding of who education should serve, who it should be for, who it should belong to, who it should be shaped by, because we haven't ended up here by accident. We haven't ended up here by chance. We've ended up here because we have an education system that is being run by fat cat vice chancellors who are more invested in protecting their pay packets than they are in protecting the health, the safety, the security of students, of workers, of communities. And because this government is so wedded to an ideological position on, paying for education as an individual and treating students as customers rather than as learners, that they can't see the wood for the trees. And so, of course, going back to the title of the session, there is no magic bullet, because COVID isn't a singular problem. It's a problem that has multiplied and amplified the countless problems already there that, the student community, the student movement has been banging down the door on year after year. And these problems across not only students, but also workers and broader communities are rooted in austerity and injustice. And now it's time to harness that anger, the frustration and the politicization, in fact, that a lot of people have felt in response to this pandemic, and to turn that anger into action and organize for a new normal and refuse to go back to how things were. And I'm really, really proud to say that you have to look no further than the student movements to see how we can do that, because we're now seeing the biggest wave of student rent strikes in all of student movement history, with students at over 50 universities withholding billions of pounds in rent. And these strikes, I want to make the point that these strikes aren't only securing rent rebates and rent reductions in the here and now, they also, in their collectivism, pose an inherent resistance to the tyranny of the marketized university. They pose an inherent resistance to the idea that students are individual customers. They pose a broader resistance to systems that put profit over people, because while we inherited an incredibly broken system that does just that, we refuse to go on with them. We're not willing to tinker at the edges or to accept crumbs when we could go after the whole cake. We know what we're experiencing is just the tip of the iceberg, and it's indicative of an education system rotting at its core. And through the NUS Students Deserve Better campaign and our petition, which I hope you folks can support, we are also declaring that now is the time to grasp at the root of this injustice. Now is the time to be radical, to be visionary, and to build a new vision for education, and for students to contribute to building a new vision for the world. And so we stand in solidarity with our sister unions around the global student movement who are also on this journey, because of course we're not alone in this, and that really relates to what Belle was saying about this being an internationalist effort and none of us winning unless all of us win, and really pushing for zero COVID in the most global sense. But of course, we also stand in solidarity with all the workers here and around the world who are fighting for a new normal too. Because, collectively we can achieve zero COVID, we can build a new normal, and we can find a magic bullet on our own terms, which comes in the form of a more just society and a more just world. So, I hope that kind of illuminates some of the things that students have been facing, some of the things that we're envisioning for where we go next. But I will round off there, and I just thank you so much for the opportunity to make a contribution this evening alongside so many amazing speakers. And I will drop some links in the chat to ways that folks can support us and support the broader student movement. So thank you so much.
Oh, Larissa, thank you so much. And it's so important to support young people. Unfortunately, I'm old enough to remember the days of free university education. And certainly when I was a student nurse, I was actually paid a wage to get training in a career. And it really distresses me just how much has been taken away from young people over the years. I'm going to take this opportunity to do a few reminders before I introduce the next speaker. So please go over and like our Zero COVID Coalition Facebook page. We're also on YouTube. And I'd like to remind you all that the hashtag for this event on Twitter is Zero COVID and Vaccines. So share us, like us, get us out there on the cybersphere. So now I'm going to move on to our next speaker. He's Rory McLean from Momentum, and he's going to speak about opposition to this government and how we can achieve that. And goodness me, we really do need to do that. So over to you, Rory, and welcome to the meeting.
Thanks for leaving me that easy topic, Helen. No, it is a pleasure to be here tonight. Like I said, I'm Rory McLean. I'm a trainee paramedic in Glasgow, and I'm a member of Momentum's NCG. And just first of all, off the back of what you said, Larissa, it was when I said Momentum solidarity to all the students on rent strike at the moment, and that is an incredible collective feat that they're undertaking. It's been a strange year to be training as a paramedic, forgetting what your colleagues look like with a mask on, the sort of full white suits and visors we have to wear that make us look like slightly misshapen clowns rather than paramedics. You know, telling families only one person can come when you rush them into hospital. None of those things needed to happen. And exactly as Belle said earlier, this pandemic has exposed the fatal consequences of underfunding the National Health Service for a decade. There were so many mistakes that have been made in the past year, each one preventable to some degree or another, and each one of those mistakes contributing to about the 118,000 people that have died in this country now. I mean, it's no wonder that people see the vaccination programme being hailed as a panacea, and it is a remarkable achievement. I mean, decades of public funding for vaccine research has been made into something that is being distributed by NHS staff everywhere. You know, people have volunteered their time, they've come in from other professions to do it, and I take my hat off to them. But in my view, it isn't a panacea. And whilst the vaccine may mediate the worst effects of the virus, it doesn't totally stop it spreading, as other people have said. And now the government wants to wait until sort of all the high risk groups have been vaccinated and then reopen our economy and accept the risks to the less vulnerable. And it's interesting, when I thought about that, it made me think of one of the strange but very special insights you get when you're a paramedic, is that we often deal with people's health, but in their own homes. We get to see the lives of the people that ring 999. And for many non-urgent calls, there's a thread that I see connecting them. And I think most other paramedics would recognize it too. And it's something that I'm sure everyone on this call knows, is that the poorest, the illest, you know, suffer the worst mentally, suffer the worst physically, develop the more chronic illnesses. And if we don't get to a point where we eliminate community transmission, there is no reason to say that in the long term, it wouldn't be those people that pay the costs. Because if you're ill and you're low paid, you're poor, you can't take time off when statutory sick pay is less than £100 a month to get better. And those mild symptoms might get worse. And what this means is, you know, your health is fundamentally linked to your position in society. Your health is fundamentally linked in this country to your class and to your race. All the research shows it in everything I see out on the road, every case that I go to, every house that I go in, every flat that I visit confirms that to me, and it confirms that it's a truth. And now, if we go down the path of saying we accept COVID as part of the future, then we're accepting the continuation of those inequalities as endemic alongside the virus. And it also means we're building in extra burden on staff who look after them. And again, it makes me think about my colleagues in the ambulance service. You know, 1 in 3 of them, 33%, have had COVID. And many of them are still dealing with the effects of it, dealing with long COVID, dealing with the dilapidating effects. Now, we need a zero COVID strategy, not only to ensure the health of people in this country, but also to protect the workers that will be forced into contact with it in hospitals, in supermarkets, in all the other settings. And I think for Momentum, you know, a lot of speakers here have outlined the medical side of it, the political side. And I guess for us, we have a very practical role that we can play in this campaign. And for Momentum, it means a few different things. One of them is clear communication on why zero COVID is the right strategy. And we do this by using our digital platforms. Last year, Momentum reached over 20 million people in the UK with some form of our content. And we should be utilising, and we will be utilising our platform to highlight the importance of this goal. shifting the framing of the argument in our favour, away from, the vaccine being a panacea and opening up to showing and winning popular support for this idea. And also putting out videos where we can combat the vaccine hesitancy that other people have referred to in communities, and where we can kind of combat that idea directly at the source through using popular media. I think this is going to be one of the really, really key things in the next couple of months as well, especially if we want to get to zero COVID. And another way we can do this is through trade unions. And Momentum's soon going to be launching our own trade unionist network. Now, the point of this is it will allow activists to support one another, share skills, coordinate, for instance, to combat the drive to push people into unsafe workspaces and build campaigns like we saw the National Education Union did to pressure the government and the Labour Party especially into policy changes. I mean, this means backing people like the GMB, Unison, their campaign for a pay rise. I think like Larissa said earlier, people don't want to be valorized and treated like heroes for the work they do. They just want proper pay and they want safe conditions. And that is one of the fundamental things what we've got to campaign for as part of this zero COVID strategy. And we want to work closely with the Labour Party to push it. And we want to work really closely with socialist MPs like Diane, like Belle, and everyone in that group. And we want to provide a movement behind them that can support them to take strong positions on how we confront capitalism after this virus. It's that communication, it's that campaign building, and it's that linking of the movement with the people in the public sphere that will really allow us to create sort of a dynamism behind this campaign. Now, it's up to us to pursue a response that puts people ahead of profit, that benefits the great majority instead of the small elite. And it's that great majority has to be protected by bringing COVID down. And only then are we going to be able to see our loved ones safely, attend workplaces without fear, and start to reshape the economy away from capitalism. And I think that is Momentum's role, is to facilitate the together of these groups and use our resources to push this campaign as far as possible.
Thank you so much, Rory. And it's so lovely to meet a paramedic, because in my day job as an official for the GMB, I organise the non-emergency hospital ambulance transport workers. And some of them are outsourced to private companies, and they've been treated absolutely disgracefully by the employer. But that's not what's important. What's important is they're stepping up to be GMB reps, and they're doing absolutely fantastic work to push back against some of the exploitation that they're enduring and some of the health and safety risks. So it's lovely to meet you. Okay, so I think it's time to move on to our next speaker now. Our next speaker is from the Zero COVID campaign himself. His name is Roy Wilkes, and he's going to talk to us in a little bit of detail just about the campaign, our activities and priorities for the coming period. So over to you, Roy, and welcome to the meeting.
Thank you, and thank you to the Zero COVID Coalition for inviting me to this important discussion. We learned at our Ecology and Economics of the Pandemic event on Saturday that the real birthplace of COVID was not the wet markets of Wuhan or the bat caves of the Chinese hinterland, but the financial centres of London, Amsterdam, New York and Hong Kong. How so? Because it is the insatiable appetite for accumulation that drives the continued expansion of fossil fuel production, of agribusiness and factory farming, of deforestation and the commodification of nature, all of which are exposing us to so many dangerous new pathogens. COVID isn't the first pandemic this century, and it certainly won't be the last. We need to connect the dots. It is exactly the same force, finance capital, that is behind the privatization of our health services. And the domination of finance capital also explains why the vaccine, a technical solution that can be commodified, is promoted and propagandized as the only way out of this crisis. The Johnson government is unable and unwilling to interrupt the circulation of capital, even for the few short weeks it would take to drive transmission close to zero. They are more than happy to rack up huge state debts that their containment strategy entails, because they know or think that they can offload those debts onto us through decades of austerity. Of course, the vaccine is to be welcomed, and its rollout is a huge credit to the NHS, as others have said, and it demonstrates the immense advantage of local public sector delivery over the corporate test and trace that delivered nothing but world-beating incompetence last summer. But the technical solution of the vaccine has to be part of a broader social solution to the crisis. The vaccine must form part of an elimination strategy. It cannot replace an elimination strategy. And relying on the vaccine alone is dangerous because allowing the virus to circulate freely invites further mutations. The UK government's next move may well be to reopen the schools on the 8th of March. That is a reckless and irresponsible plan. Schools are among the main vectors of transmission. They should remain closed until transmission is low enough for a rebuilt, locally based system of find, test, trace, isolate and support to keep transmission moving down towards zero. Not only that, but other COVID unsafe workplaces should close as well and should remain closed until they are safe, both for the people who work in them and for the wider community. We in the Zero COVID movement are often caricatured as advocating indefinite lockdown. Nothing could be further from the truth. An effective lockdown would be a short lockdown. Then we could all have the social freedoms that have long been enjoyed in New Zealand, Vietnam, Taiwan and elsewhere. It is the failed containment strategy and the associated reliance on vaccines as the silver bullet that has delivered endless and repeated lockdowns as well as horrific death tolls. So of course, we in this meeting all know what the government should do about COVID, and we know why it isn't doing those things. But the key question is, what are we going to do as ordinary working people? Well, the answer is absolutely clear. We need to build a mass movement to fight back in the workplaces and on the streets. The only way we can get the changes we need is to build an unstoppable movement that can force the changes we need. That's why Zero COVID, the campaign to beat the pandemic, is calling a day of action on Saturday, the 13th of March, to protest this recklessness and to make a loud and visible statement of mass opposition to the government's failed COVID strategy. And we aim, through such action, to boost the confidence of workers to do what the NEU did in January and say no to workplaces that are unsafe. Unsafe not only for the people who work in them, but also for the wider community. The day of action will include safe, fully masked, socially distanced and risk-assessed outdoor protests. And we always include a simultaneous online rally so that those at the highest risk of COVID, and particularly disabled people, can take a full and active part while remaining indoors. Since our last day of action in December, there has of course been an important new development in the Zero COVID movement. This coalition has been formed, an initiative that we fully support and are proud to be a part of. We now need to combine our strengths and mobilise this coalition into an unstoppable force. Johnson will say that in order to make possible the reopening of schools, other restrictions must remain in place. It would be totally unacceptable for those other restrictions to include a continued ban on political protest. Schools and other indoor workplaces are transmission belts for COVID. Fully masked, socially distanced, risk-assessed outdoor protests most emphatically are not. To continue to ban such protests would be a cynical manoeuvre thinly disguised as a public health measure. Of course, the far-right anti-lockdown protests were unsafe, but they were not masked and they were not socially distanced, and they were certainly not risk-assessed. It would be absolutely right to insist on a requirement for proper risk assessment of responsible protest action, which was the situation we had before January. It would be wholly wrong to impose a continued blanket ban. The TUC has found that 20% of workers who could work from home are being forced to go into enclosed workplaces. Not a single employer has been fined for this outrage, not a single one. Yet ordinary people are being fined day in, day out for minor infringements that are far less risky. This is the double standard we face. Capital gets a free ride, ordinary working people pay the price. We need to be prepared to robustly challenge and resist any such repressive order. And we would urge the MPs here to expose and resist in Parliament any cynical manoeuvres by the government along those lines. If politicians are allowed to assemble in Parliament, then ordinary people have an inalienable right to assemble, albeit safely, outdoors. The stakes couldn't be higher. We need to steel ourselves for the battles ahead. Saturday, the 13th of March, we will be taking to the streets to protest this government's criminally negligent containment strategy. Join us via our website, zerocovid.uk. Thank you.
Well, all right. Thank you so much for that. And again, I just want to reiterate that key thing you said. It's not so much about what's happening, but it's what we do about it as we build a mass movement to go forward. I mean, that's the nub of the point right there. So thank you so much for that. That was absolutely brilliant. I'm going to take this opportunity again to remind our viewers to save a couple of important key dates that are coming up. So on Saturday, on the 6th of March, for the planned reopening of schools, we'll have a very important meeting that we want you all to attend. So that's Saturday on the 6th of March, and it'll be advertised on our Zero COVID Coalition page on Facebook. And then on Tuesday, the 23rd of March, which is the 1-year anniversary of the lockdown, we're also having an event as well. So please save those 2 dates. That's really important. So now I'm going to move on to our next speaker. And before I introduce her, I just wanted to make the point that I feel as an organizer in the NHS that the low paid migrant workers are particularly badly hit by the coronavirus pandemic. And they were the ones who found it most difficult to get the PPE in the first place. And they're also being really badly hit by these quarantine rules as well. So with all of that in mind, I want to introduce our next speaker, who's Sabi Dalu. She's from Stand Up to Racism, and she's going to go into a little bit more detail about some of those difficulties that people are facing. So welcome to the meeting, and over to you, Sabi. Thank you.
Thank you very much, Helen, and thank you to Diane and the Morning Star and others in the Zero COVID Coalition for inviting me here today. So regarding the vaccine, firstly, I mean, I think all of us here today agree very much with people accepting the vaccine and taking the vaccine. But I think we have to acknowledge, as others have mentioned, like Jay Patel earlier, that there has been a substantial divergence between the take-up of the vaccine. So, for example, The Independent reported at the end of January that amongst those people who have been offered the vaccine, so the sort of, you know, older sections of the community and those with underlying health conditions and so on, of those, white people were twice as likely to have accepted the vaccine than Black, Asian and minority ethnic communities. And that is a problem that isn't actually being addressed properly. And I think we need to understand why that's taking place. And it's because of institutional racism. We've seen no action from this government in addressing the disproportionate impact of COVID on BAME communities. And we've seen no proper action in trying to address the issue of what Jay Patel earlier called a hesitancy amongst communities in taking the vaccine. And it's not surprising that some sections of the community don't trust the government, because why would, you know, some communities trust a government that has presided over one of the worst death tolls in the world, one of the worst case rates in the world of COVID, and all of which have disproportionately impacted on BAME communities? So it's not surprising that those communities are reluctant to accept a vaccine. There's a lack of trust, and that needs to be addressed. And what we need to see is we need the government to implement things like what the BMA and what Jay Patel earlier said, which is that the government need to be working with communities in encouraging communities to take the vaccine. And we're not seeing that. And we also need to have the disproportionate impact of COVID, which means addressing the issues of institutional racism that has led to the disproportionate impact of COVID on BAME communities. That needs to be addressed, but we're not seeing that. And I suppose it's not surprising that the government is unable to work with different communities in addressing these issues, because I think a government with a Home Secretary like Priti Patel, who called last week the Black Lives Matter protests dreadful is absolutely horrifying. I mean, I would say that it's Priti Patel and the government that's dreadful, and their response to the COVID crisis has been dreadful, and their response in addressing issues of institutional racism, the disproportionate impact of COVID, has been particularly dreadful. And so I think going forward, you know, we need to have these issues addressed, and Counter-Racism is calling for a public inquiry into the disproportionate impact of COVID on BAME communities. And finally, regarding the issue of vaccines not being a silver bullet, which is the title of this meeting, I mean, that's absolutely correct, because if you look at the age groups for which the case rates have come down, it's amongst the younger sections of the population that have not actually had the vaccine. So what's been effective in reducing cases and deaths has been the lockdown. It's been the school closures, it's been moving higher education to online, and it's been closing hospitality. Now, so I think going forward, we cannot see, or we must oppose and campaign against any premature easing of the lockdown, because that is what has successfully reduced cases in the past few weeks. And it would be, you know, terrible if we were to ease the lockdown prematurely and cases were to go up again. I think we're all fed up of this yo-yo of locking down and easing the lockdown prematurely, then locking down again. It's been almost a year, and we need to get out of this cycle. We just need to implement a zero COVID strategy to suppress the virus, to reduce cases as much as possible. And it's particularly important for, you know, anti-racist campaigners like ourselves, because of the disproportionate impact this has had on BAME communities. Thank you very much.
Thank you so much, Sabi, for that. So we did want to have Linda Burnip speaking tonight. She's from Disabled People Against the Cuts, but unfortunately Linda's unwell. But we do recognise in the Zero COVID Coalition that disabled people have suffered the worst impacts of this crisis. So it's really important that we hear what Linda has to say. So if you'd all bear with me, I'd like to read out a short statement from her. So this is from Linda Barnett from Disabled People Against Cuts. And she's saying, I'm shocked at the requirement for someone to have access to an email address in order to access a COVID test. When I was looking at the government test booking website a few days ago, I noticed it said that if you're booking a test for someone else and they don't have an email address, you can't use the system and should call 119. When my mum called 119 last night, they asked for her email address. Fortunately, she has one and managed to respond to their email, giving her a code in order that she could order her home test. She's not really very good at responding to emails, so she asked me to look at it for her, and I confirmed that she'd done it properly. She asked the person what would happen if she didn't have an email address, and they said that she'd have to give a friend or relative's email address. And if she didn't have access to that, she wouldn't have been able to have a test. So Linda is really, really shocked at that. So like I said, we'd love to have had Linda with us tonight. You know, we'd love to have had a voice from Disabled People Against the Cuts, but Linda couldn't make it tonight. So once again, I'll remind all of you, please share this stream on Facebook and Twitter. And please just like our page, which is the Zero COVID Coalition, and on Facebook. We're on YouTube as well. And the hashtag for this event is Zero COVID and Vaccine. So you can tweet us and share us, please. We want to get out there because the speakers tonight have been so interesting. We really want to get them out there and what they have to say around this discussion. So my very last speaker, she needs no introduction at all, and she's been doing she's been a key ally in this Zero COVID work and driving this work forward. It's Diane Abbott MP. So she's going to be talking about the government's claims against the vaccines and also the pressure on ethnic minority communities. So it's a great pleasure to have you here, Diana. So over to you, and welcome to the meeting.
Thank you very much, Chair. Can you hear me?
Yeah.
I'm very pleased indeed to be speaking at this important meeting and to be able to make the case for a zero COVID strategy. We all know that the COVID pandemic is the biggest public health crisis in the lifetime of anybody on this call. And at one point, the government was trying to say, or seemed to be trying to say, there was a trade-off to be had between health and the economy. What they've actually managed to do is make sure we have the worst of all possible worlds. We have one of the highest death rates in the world, and we've had one of the biggest economic hits in Europe. But one of the things that the coronavirus pandemic has illuminated in this country is the issue of inequality, both social inequalities and racial inequalities. The newspapers were reporting very recently that Black and Asian people are half as likely to have been vaccinated, but 4 times as likely to have died from COVID. And I think we all remember in the early days of the pandemic last year, the disproportionate numbers of Black and minority healthcare workers, including doctors and nurses, that were dying on the front line. Now, there was an argument coming from commentators that there was possibly a genetic explanation for this, or it was to do with Black and minority people and our comorbidities. But the truth is that death rates across Africa, across the Caribbean and Asia, are actually generally lower than in this country. And the real reason why so many Black and minority ethnic people have died and are suffering from COVID is to do with social conditions, the jobs people do, how they're treated at work, their housing, and their access to healthcare. And all these inequalities are the product of racism. And much as the government and government ministers would like to deny that disproportionate levels of coronavirus are to do with social inequality and to do with institutional racism, this is what the figures tell us. For instance, the TUC has recently reported that Black and Asian people are 26 times more likely to have been fired during the pandemic. That's got nothing to do with genetics. That's to do with institutional racism in the workplace. And economists and statisticians have identified the huge disparities between richer and poorer areas of all our cities. And this virus is hitting poorer people, disabled people, and Black and Asian people the hardest. Now, there is some opposition to the idea of a zero COVID strategy. It's being said that it's now impossible to implement zero COVID policies, but this isn't true. This country got down to 550 new cases a day and 7 deaths a day in the summer. The problem was our test and trace system, the Serco test and trace system, wasn't functioning properly. I want to say now a few words about vaccination. Other speakers have spoken about vaccine hesitancy among Black and brown people. Well, it's not surprising in a way that people are hesitant and concerned. Black women are 4 times more likely to die in childbirth than white women. Black and minority persons have a terrible experience in our mental health system. So if people are skeptical, if people are mistrustful, there is some basis in their lived experience of institutions and even the National Health Service itself. I believe in vaccination. I have tried to encourage communities to come forward with vaccination. I was in Stamford Hill in North Hackney at the weekends, encouraging the Haredi community. I got together with others and put out a video encouraging minorities to get vaccinated. So I think vaccination is very important and is certainly part of the solution to the pandemic, but it's not a magic bullet. It's not a magic solution all on its own. If we are going to roll back the coronavirus pandemic, first of all, we have to look at issues of inequality, inequalities here in this country, both social and racial, that have proved a breeding ground for the coronavirus infection. We also have to look at international inequality, because it's no good Western countries boasting about how many people they've got vaccinated. We are not safe until everybody is safe. And money must be found and effort must be put into making sure that some of the poorest countries also have access to vaccination. So we have to look at inequality, both inequality here in this country and inequality internationally. We have to come behind our NHS. One of the most noticeable things about the coronavirus pandemic in this country was how test and trace was really very disappointing and very unsuccessful. And this was something that was run by Serco and Deloitte and other private sector organizations. Yet the vaccination rollout was run by the NHS and was much more successful. If we're intent on bearing down on the coronavirus pandemic, this government needs to understand that it has to stop defunding the NHS, because the truth is that it's the starving the NHS of funding in real terms, which meant the NHS was not in the best place to deal with the coronavirus in terms of beds, in terms of nurses and doctors and availability. The government needs to stop defunding the NHS. Clapping is all very well. Talking about our NHS is all very well. But actually, this government needs to put its money where its mouth is, and it needs to move away from an obsession with private sector health solutions. So we're in the middle of a terrible public health crisis. It has taught us the benefits and the resilience of our NHS despite years of this government defunding it. It's taught us the importance of the public sector generally, and how you can't rely on private sector solutions and handing out dodgy contracts for PPE to your friends. I believe that we can counter the coronavirus pandemic. I believe we can bear down on the terrible death rates, particularly amongst the poor and Black minority ethnics. But the vaccine is not a silver bullet. Dealing with the underlying social and economic issues, both in the short term and the longer terms, is the real solution to the tragic coronavirus pandemic that we find ourselves in the midst of. Thank you very much, Chair.
Well said, Diane, and what a fantastic way to close this meeting. And I'd just like to make a final few points before we do finish. As an officer for the GMB trade union, I have seen that when workers step up, stand up and stick together, they can and they do win. And the points about building the movement and coming together are so key out of this discussion. So I would say, if you're not in a trade union, don't just join a trade union, become active in that union and join the social movements like the Zero COVID Coalition and the People's Assembly. And let's link up all the work, because together we're just such a powerful force for good in society. So thank you so much for tuning in and listening to our amazing speakers. I've certainly learned a lot. Good evening and have a very good night. Thank you.